compressions, what we're basically doing is using our hands to help our breasts empty. So the idea is baby's latched onto the breast, feeding away, and when baby's swallows have started to slow, so they'll probably go on straight away, do some sucking to stimulate that flow, and then you'll see them hopefully go into those deep swallows, removing the milk. And then as your breast empties, what you're likely to see is baby starts to have to do more sucks to each swallow, and that is just because the breast is emptying and the baby needs to do more sucks to get the amount of milk they need. And start to slow down or stop, you can get in there with your hands and just push out a bit more milk. If you think about wringing out a sponge, it can be a really effective way to just help baby keep drinking actively. Because when a baby is doing those deep consecutive swallows, they're obviously getting a bigger volume of milk, and in a situation where we're not sure baby's getting quite enough, we would like to see more weight gain, you'd like to increase your supply, compressions can be really helpful, because the emptier you keep your breast, the quicker the milk regeneration will be. So what you can do is use your hand, put it on your breast, imagine the baby's attached as well, put it on your breast, squeeze and hold that squeeze. You've got to be careful to do this, you don't pop baby off their latch, so it's got to be further enough back that it's not going to disturb the latch, but you just squeeze, hold that squeeze, and hopefully what you'll see as a result is those swallows will pick up again, you'll be back to those deeper swallows. Hold that pressure all the time you're seeing those swallows, and then when those swallows start to subside, at that point, release, rotate your hand and squeeze again. And we're going to repeat this all the way around the breast. So if you think about your breast being a clock face, you're going to do it all around your breast, whatever angle you can get your hand. So you can do it with a flat hand here, you can do with a squeezy hand here, whatever you can get that sort of pressure on your breast, squeeze and hold. And that is how you're going to get more milk to the baby, make more room in your breast to regenerate more milk. When you've gone around one breast, you're going to switch to the other and repeat. So let the baby come to the breast, have that initial first let down, hopefully get in there with some compressions, empty, get the baby drinking all around the breast, and then if necessary switch again. So you can switch backwards and forwards multiple times at a feed, because what that means is overall baby's going to be getting a bigger volume of milk. And remember, we're not worried about the type of milk, we're not taking any notice of the fore milk, hind milk thing here, we're thinking about a volume of milk. So we just want to keep baby drinking as actively as we possibly can.